Hello, my name is Blake Grothaus and I have epilepsy. Epilepsy is a condition that affects the brain. It causes people to have seizures. A seizure is when the brain signals get mixed up, leading to sudden changes in how a person acts or feels. Epilepsy can start at any age, and it affects people all over the world. Most people with epilepsy live normal lives. They go to school, work, and spend time with friends. But because they can have seizures at any time, they must take special care. With the right treatment, many people with epilepsy can control their seizures. Doctors do not know why some people get epilepsy. For others, the reason is clear. No matter the cause, having epilepsy is nothing to be ashamed about. Epilepsy can be managed in many ways. Medicines are the most common treatment. Some people may also need special diets or even surgery. Talking about epilepsy helps people understand it better and makes life easier for those who have it. There are many ways a person can get epilepsy. Sometimes it starts after a brain injury. This could be from a car accident, a fall, or even a bad infection. Other times, epilepsy runs in families, which means the risk is passed down from parents to children. Some babies are born with differences in their brains. These differences can cause epilepsy. In older adults, strokes or tumors can be a reason. Sometimes doctors cannot find any cause at all. Having a fever when you are young can also be linked to seizures. These are called febrile seizures. Not everyone with a febrile seizure will get epilepsy, but it can be a risk factor. Other things can trigger seizures in people who already have epilepsy. These include missing medication, lack of sleep, stress, or flashing lights. Knowing these triggers can help people avoid them and lower their chance of having a seizure. The brain works by sending electrical signals. In epilepsy, these signals can become too fast or confused. This is like a power surge inside the brain. When this happens, a person may lose control of part or all of their body for a short time. Depending on where the surge starts, different things can happen. Some people might stare off into space and not respond. Others may fall down or shake all over. Sometimes they feel strange or see things that are not there just before a seizure. People with epilepsy might feel tired or confused after a seizure. This feeling can last for a few minutes or even a few hours. Their body needs time to recover because the brain has worked extra hard. Epilepsy does not mean that the brain is always having problems. Most of the time, the brain is working just fine, but when a seizure happens, the electrical signals in the brain are not working as they should. So, a seizure is a sudden burst of electrical activity in the brain. This can cause different symptoms depending on which part of the brain is affected. Seizures usually last from just a few seconds to a few minutes. And, seizures can look really different from person to person. Some people might fall to the ground and shake, while others may just stare or make small movements with their hands or face. Sometimes people may not even remember the seizure happened at all. Epilepsy is diagnosed when a person has had 2 or more seizures that aren't caused by a fever or something else temporary. Doctors use tests like EEGs to look at the brain's electrical signals and help make a diagnosis. Having a seizure can be scary, but honestly, most are not dangerous by themselves. If you see someone having a seizure, it's important to stay calm, move dangerous objects away, and just wait until it is over. But if the seizure lasts more than 5 minutes, or if the person does not wake up, get medical help right away. There are actually many types of seizures linked to epilepsy. The most well-known is called a tonic-clonic seizure, also known as a grand mal seizure. In these, the person may fall, stiffen, and shake all over. They might lose consciousness for a short time. Afterward, they can feel very tired and confused. Another type is an absence seizure, also known as a epilepsy seizure, which is pretty common in children. The child might just stare into space for a few seconds. They do not fall or shake, and they may not even know it happened. Teachers sometimes think the child is daydreaming. Some people have focal seizures, which start in just one part of the brain. These can cause unusual feelings, movements, or sensations. For example, a person might suddenly feel fear, taste something strange, or move one arm without meaning to. Each person's seizures can look different, so it's important for people with epilepsy and their families to learn what to expect. Knowing the type of seizure helps doctors choose the best treatment. With good care, most people with epilepsy can live full lives, though it can be harder for others also. Subscribe to help support.